Good afternoon. Thank you, everyone, for joining us for the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang, Senator Stone, Senator Taylor, Senator Titus, Chair Doniate.
And I'm here, and please mark Senator Lang absent excused. Good afternoon, everyone, and thank you so much for joining us for today. Today we do have two bill presentations on Senate Bill 84 and 184. So my goal is to get us out of here within the next hour. So hopefully, fingers crossed, we'll make that goal. A few housekeeping items. So I am going to take the items out of agenda order because of a special request. So we're going to do the latex bill for Senate Bill 184, and then we'll do Senate Bill 84. So that'll be the order of which we'll start. For those of you that are interested in participating today, if you wish to testify, you can sign in at the table by the door and provide a business card to the committee secretary. And if you do not wish to testify, you may also want to sign in so that way we have a record of who's here. When testifying, please turn your microphones on to speak and off to listen. And we have listeners both in Las Vegas and online for this meeting. And there's also going to be a public comment period at the end, and we ask for those comments to be kept at 2 minutes each. And finally, we ask for folks to please turn off their electronic devices or put them in silent during the meeting. With that, let's start with Senate Bill 184. So I'm going to go ahead and open the hearing for this bill. This bill prohibits the use of latex in certain circumstances. So I'll have Senator Stone here to present on this bill. So please begin when you're ready.
Thank you, Senator Donate and members of the committee. I'm Senator Jeff Stone. I represent District 20 in Henderson. It's my absolute pleasure to be here today to present Senate Bill 184, which prohibits the use of latex gloves in food establishments and medical facilities within the state. I am delighted to be joined by Lisa Kramer, who's a local up here, who actually inspired me to bring this bill forward. Senate Bill 184 is designed to reduce the risk of allergic reactions to latex, a substance that can cause significant health problems for sensitive individuals. Approximately 4.3% of the population is allergic to latex, which translates to 15.5 million people in the United States. Specifically, in healthcare settings, data published by the Journal of Occupational Health shows that approximately 10% to 17% of healthcare workers have latex allergies. This is because natural rubber contains 15 proven allergenic proteins, HEVB1 to HEVB15, which can trigger a hypersensitive immune response in latex-sensitive individuals and may lead to death in a severe case of anaphylaxis. Latex allergy has become a major occupational health problem with an epidemic scope among highly exposed healthcare workers and others with significant occupational exposure. As for food establishments, Nevada had almost 52 million visitors in 2023, roughly 1 million visitors per week. In our restaurants, this translates to 43,000 potential latex allergy reactions per month per restaurant visit, which can be mild or, in rare cases, life-threatening. The average number of restaurant visits per week is 5. Proteins can easily be transferred from gloves to the skin directly or can contaminate food from food handlers, resulting in a reaction in those who are already sensitized. Symptoms of latex allergies can include, but are not limited to, itchy skin, rash, hives, and in rare cases, anaphylaxis, which is a potentially life-threatening condition that can cause throat swelling and serious difficulty breathing. Low-cost alternatives to latex gloves include 3 Food and Drug Administration-approved alternatives: nitrile, polyethylene, and vinyl. As of 2024, 8 states have banned latex gloves, including our neighboring states of Arizona and California. The other states are Connecticut, Hawaii, Illinois, Ohio, Oregon, and Rhode Island. With that said, I'll briefly walk you through the provisions of this bill. Section 1 requires food establishments to establish that anyone employed, operating, or otherwise working within the food establishment does not use latex gloves. A health authority would be authorized to suspend the food permit of a food establishment for violating this provision, and a violation would be a misdemeanor. Section 2 requires certain medical facilities to ensure that employees, contractors, and volunteers are not using latex within the facility. Additionally, Section 5 through Section 7 and Section 9 provide administrative and civil enforcement of prohibitions against the use of latex gloves at medical facilities. Section 4 exempts certain facilities from the requirements of Section 2, including facilities operated by religious denominations that rely on spiritual means for healing, foster homes, and facilities operated by the United States government or an agency thereof. Section 8 prohibits a provider of health care from using latex gloves where health care services are provided, outlines penalties, and defines health care facility. I do have some proposed amendments to the bill. There are 3. The first is the bill is only going to be limited to latex gloves, not to latex implements used in healthcare or implements used in the food or restaurant industry. 2, a healthcare professional can claim an exemption to this bill to use latex gloves if the healthcare professional believes that it is in the best interest of the patient to do so. 3, if there's a national shortage or any other emergency of non-latex gloves availability, the HHS director can stay the prohibition against using latex gloves for 120 days. This stay can be renewed in 120-day increments until the supply chain of non-latex gloves returns to normal. At this time, I'd like to introduce again Lisa Kramer, who is the inspiration of this bill, to give her testimony.
Thank you, Senator. Mr. Chair, members of the committee, my name is Lisa. Mr. Chair, members of the committee, my name is Lisa Kramer from Minden, Nevada. I am representing myself, and I support this bill because it could prevent my latex allergy from getting worse, and it could save my life. Since there is no cure for a latex allergy, the only thing I can do is avoid latex, because the more I come in contact with latex, the worse my allergy gets. The sad part is that a latex allergy is preventable. Living with a latex allergy is hard. I don't wear clothes with elastic waistbands. I buy special latex-free underwear, swimsuits, socks, and one particular brand of shoes because their whole line is latex-free. Because latex cross-reacts with other foods, I watch for other food allergies. I can't use pencil erasers, rubber bands, and Band-Aids unless they are a latex-free version. If someone enters a room I'm in with balloons, I leave the room. I won't get a vaccine that contains latex in the syringe plunger or the vial stopper. I have to remind healthcare offices of my allergy so they don't use latex gloves or other things made of latex. Once I had an ultrasound where they used latex and I knew within seconds. The technician told me it was my fault for not reminding her even though the allergy was in my chart. The internal pain of the exposure lasted for an entire week. Before I could see a physical therapist, all of the equipment like balls, resistance bands, foam rollers, mats had to be checked. If I have a medical procedure or surgery, everything needs to be free of latex, from the gloves down to the adhesive tape. All of this is a lot to manage, but it was shocking the day I discovered that latex gloves can't touch my food after I reacted to strawberries that were picked in the field with latex gloves. Of course, I had washed the strawberries before I ate them, but it didn't matter because latex proteins are very sticky. Now I verify with every restaurant the type of gloves they use in the kitchen. If they use latex gloves in the kitchen, but they say they will prepare my food using latex-free gloves or no gloves at all, I still can't eat there because the entire kitchen is contaminated because they use latex gloves. I've read that when a restaurant moves to a latex-free gloves, it takes approximately 3 months to rid the kitchen of latex. Most restaurants don't even know that latex gloves are dangerous for workers to wear, as repeat exposures cause a latex allergy to develop. A few weeks ago, when I was in Las Vegas, 3 of the restaurants I wanted to eat at with my family used latex gloves. In a few months, I won't be able to eat at my sister's wedding in Las Vegas because the venue uses latex gloves in the kitchen. The Wynn and the Encore resorts have already banned the use of latex gloves for at least 7 years. 8 states, like the senator said, including Arizona, California, Connecticut, Hawaii, Illinois, Ohio, Oregon, and Rhode Island, have banned the use of latex gloves in the food service industry. And a few have stipulations on healthcare settings and emergency responders. All of my local hospitals told me when I called that they do not use latex gloves because they know it's a risk for their staff as well as their patients. This bill means everything to me. I want to be able to go into a restaurant and see a healthcare provider and not be afraid. Hoping that a food establishment or a medical facility is educated enough to not use latex gloves is simply not enough to protect public health. Thank you, Senator Stone, for sponsoring this bill, and thank you all for allowing me the opportunity to tell my story today and for your consideration of this bill. And if you have any questions, I would be more than happy to answer them.
Thank you, Mr. Chairman. We welcome any questions you might have.
Thank you. Before we open it up for questions, I think there might be a little bit of a glitch. So for the folks that are looking for the amendment online, it is, if you go to the committee's Health and Human Services and look at the meetings for today, it'll show in the exhibits, for today's meeting exhibits, that's where it'll show. They're working on uploading it to the actual bill, so it might not populate on the actual bill. And they're bringing print copies of it too. So do you want to go over the amendment again, maybe if you can draft it, because I know a few of us just wrote it down.
I'd be happy to, Mr. Chairman. Thank you so much. So there are 3 amendments to the bill. The first is that the bill is limited to only latex gloves, not to latex implements used in healthcare or implements used in the food or restaurant industry. 2, a healthcare professional can claim an exemption to this bill to use latex gloves if the healthcare professional believes that it is in the best interest of the patient to do so. And 3, if there's a national shortage or any other emergency making the availability of non-latex gloves unobtainable, the HHS director can stay the prohibition using latex gloves for 120 days. This stay can be renewed in 120-day increments until the supply chain of non-latex gloves returns to normal.
Thank you. And the committee members just got a copy of it, but just for the general public that's watching, it's under the exhibits for the meeting, and we're working on uploading it to the bill. Questions? We all got questions. Okay, Senator Titus.
So thank you, Senator Stone, for bringing this forward, and I appreciate the testimony. Frankly, I'm very sorry for your allergy. I mean, it obviously is could be life-threatening, and I hope you carry an EpiPen. They're out there, and if you don't have one. But my concern is bills like this. I have grave concerns over bills like this because we're banning something, rightfully so. People have allergies to it, but people have allergies to peanuts. I mean, 2% of the population has allergies to peanuts. Even worse, cucumbers. 15% of the population has allergies to cucumbers. We don't ban cucumbers. And I know my son-in-law has a terrible allergy to cucumbers. He carries an EpiPen because we'll go to a restaurant, and occasionally, even though they say there's not cucumbers in it, there might be a cucumber in it. And so we're kind of being self-aware, and I think my granddaughter has multiple food allergies, but we're not banning the products. And so in latex, I use latex gloves. I especially use them not only in procedures, but out. I'm cleaning a deer. I'm out harvesting an animal. I want the best glove out there and strong, and latex is that glove. And so the other ones break. All the ones you listed, when I've tried them, they come in hunting bags, they break. And so I worry that we're passing a law because of an allergy, and I understand your allergy. It's severe. I'm sorry, I've seen nurses have allergic reactions. We always provide non-latex gloves in our facility and in my office. But that doesn't rise to the banning of a latex glove. And so I just have real concerns about setting a precedent because we're not banning peanuts and we're not banning cucumbers and all the things that people truly have allergies to. And just so why is it that there, and again, your story is significant. I don't want to undermine what your story is, but what, are you allergic to any other thing? Is latex the only thing in your life that you're allergic to?
Lisa Kramer, for the record. No, I have other food allergies.
And
So I cannot eat gluten or dairy, and I have my latex allergy.
Right.
I think for the difference is there aren't gloves made out of gluten or made out of dairy, so that every time I try to eat out somewhere, I can get exposed. So I manage my other food allergies at a restaurant, but when you wear gloves that prep everything, touch everything, serve everything, proteins are everywhere, it would be like your relative that has a cucumber, if they had gloves made out of cucumbers and everything in that restaurant was always being touched by cucumbers, so your family member couldn't order anything in the restaurant.
I think, I thank you for that, and I'm sorry about, your allergies are significant, and I don't discredit, and I appreciate you being here and being an advocate for yourself. But again, I worry about sectioning out any one particular thing because of an allergy, and when there's other potential benefits from this product. So that would be my concern, Senator Stone.
Thank you, Senator Stone. For the record, thank you, Mr. Chair, through you to Senator Titus. That's why I put a physician's exemption in there for physicians that feel that the alternative gloves, the polyethylene, the vinyl, the nitrile gloves that you're alleging are not as durable as latex gloves. So that's why I purposely put that exemption in there. But when you see so many visitors that come to Nevada every single month, and the general population, roughly about 6% are allergic to latex, there's probably a lot of people that get sick coming to Las Vegas and don't even know why they're getting rashes or highs when they go to a restaurant, maybe thinking it's a food allergy or something like that. When there's such low-cost alternatives, and many restaurants have already gone to non-latex, a lot of healthcare facilities have already gone to non-latex, it just seems like a very logical thing to do. It's not causing any financial insults to any of our businesses. That's the last thing as a businessman I'd ever want to do. I just want to try to minimize anybody getting sick in restaurants or in medical facilities if we can do some simple revisions in the law, and this is what I consider to be a simple revision in the law.
I was trying to write down my questions and my remarks. You're good. Vice Chair Taylor.
Thank you, Chair, and thank you, Senator, for bringing the bill, and thank you so much for sharing your story. I along with my colleague, my heart goes out to you. I can't imagine what that's like. So I do have two questions. So if one is, you mentioned 6% of the visitors to our state. Do we know how much from a population standpoint? Standpoint, is it 6% of the total population that has this allergy?
Senator Stone, for the record, thank you, Senator, through you, Mr. Chairman. Roughly 6% of the population, by different studies, show that the American public is allergic to latex. So if you just extrapolate that to the number of visitors, so we get 1 million visitors a month, that's quite a few people that are being exposed for each meal that they're coming into contact with latex. So that's where that number came from. And it's shown that 10 to 17% of healthcare workers are allergic to latex because of the repetitive exposure over the years.
Thank you for that, Senator Stone. I have another question. You said you recommended in one of your amendments that the director of a healthcare professional can the HHS director can stay the prohibition for 120 days. And why 120 days?
You know, I kind of modeled that after the cage-free egg debacle that we just went through. They stayed that for 120 days until we can have more hens laying eggs in cage-free environments. So I kind of modeled it after that.
All right, thank you, Senator. And again, thank you so much for sharing your story. Chair, thank you for your two questions.
Thank you. My questions, sorry, I'm like trying to get all, it's okay. Okay, so I want to just ask more of clarifying questions based on your conversations with stakeholders, and then more on the bill specifics. So, more from my lens, working in primary care, we use nitrite gloves. I mean, that's the one that we use for the purpose of the latex allergy. I think it's clearly it is more expensive. I just want to make that clear that I think we pay like $5 more per box than the latex gloves that we would purchase. So there is an economic shift, right? We use it because my medical assistants like using the nitrite gloves, and they look cleaner because they're blue, but it's just our preference and what we order from McKesson. I guess my question is, so more shifting towards the restaurant portion, if there's a concern of using these types of gloves in the food environment, which clearly makes sense, right? Why not go for the disclosure then of latex gloves on the menu versus completely banning a product on the market? And I guess the reason why I'm asking that is when you ban things from the market, and this is like I guess now I'm like the free market approach. Jesus.
Yay.
No, hold on.
Hey, yay.
It's deja vu. No, but I mean, when there are things that are banned from the market, there's obviously an economic shift that occurs, which could lead to sales tax revenues being shifted or substitution of certain market products. And so I guess the question is because there's a supply chain issue that could potentially erupt or result from this change, wouldn't it just be easier to just require restaurants to have the disclosure that they're using latex gloves the same way that they disclose shellfish or milk allergies on their menus?
Thank you, Mr. Chairman. I think it's a great question, and what I don't want to do as a businessman and running multiple pharmacies and respiratory business, it's in a retail establishment, is that I don't want restaurants to have to go reprint all their menus and put all these disclosures. I think that'd be a much more expensive burden for businesses. I don't want to put more burdens on them. I think it'd be less burdensome just to have the ban and have them find alternatives, which are already, a lot of restaurants already do this. They're already protecting their clients because they don't want to have their clients to have a bad reaction. So I think I don't want to put that mandate on businesses.
But I think that's where like the confusion comes, right? Because it's on one mandate, all you're putting it is on the menu that you can reuse versus an actual $5 increase to the supplies that they need to produce their food equipment. So there is an economic shift that's going to occur from transitioning from using one gloves to another, right, for preparation. And so if that's the case, and if restaurants are already doing this, then I guess the question is if the ban is necessary, and maybe you can elaborate as to why you feel it is.
Well, I know that there are different gloves that are FDA approved. You mentioned that nitrile gloves are more expensive than latex gloves. In my experience in running my compounding pharmacy, I have found the alternatives to be equal or in some cases less expensive than even latex gloves, and we weren't going to take any chances in the pharmacy. We just went with the non-latex gloves like you used in your clinic. Certainly, we could have put disclosures in menus and not proceeded with the ban. That would have still prevented my client from going to these restaurants after she read the menu. She'd be picking up her purse and she'd be leaving the restaurant. I think it would be safer for the million people that come to visit Nevada every month to have the comfort to know that they can go into restaurants and not have to worry whether or not their latex allergy is going to be exacerbated in the restaurant that they're visiting or not.
So more of a follow-up question. And maybe you can help me with this. Do you have the prevalence of how common a latex allergy is in terms of like the population? Like, is it? I know my colleague mentioned the peanut allergy reference. Do you happen to know like how many Nevadans are projected to have this type of allergy, or if there's a percentage?
6% of the population allegedly is allergic to latex.
Great, thank you. I guess the part that I'm like struggling with is, does this, and it's weird because it's like we're trying to, I understand the public health perspective of trying to make sure the public is protected, especially if we don't want folks to go into anaphylactic shock. We 100% should do that. But I guess does this bill set the precedent then to ban other food items that do cause allergies from being listed on menus, right? Because there could be a scenario where if I have a peanut allergy that I could come back next session and say, well, if we passed a latex ban on the prevention of using gloves to prepare food, then why don't we go for the other allergies that cause such detriment, right? So I don't know if you can speak to that.
Lisa Kramer for the record. I guess myself living with other food allergies, I navigate that. I have tools for that. I have apps that review restaurants that I know if they're able to handle my allergy or not. So personally, I don't think it is feasible to eliminate, because people can be allergic to any proteins, right? This just seems like something that can be easily accommodated with a change in gloves that doesn't affect the business. And in my research, like I looked on Amazon a few weeks ago, 100 latex gloves cost, and one was $12.79, $12.30, $9.99, and one was $6.15, which wasn't the average. A nitrile box of gloves was $9.99 or $8.68, and vinyl gloves were $7.99. So in my research, actually, I think latex gloves used to be cheaper, but now I'm finding they're even more expensive. So I don't know if I understand that there's that much of an impact to a business. I do know the restaurant that I frequent in my town of Minden, Nevada, sent in a letter of support, and they actually used to use latex gloves there. And they stopped using the gloves for me, and she told me and wrote in her letter of support that the staff actually likes it better. So personally, I don't have any intentions of trying to ban all of the allergens or the two other allergens I have. I just feel like this. And a lot of people that have a latex allergy, I mean, most people that have a food allergy know they have a food allergy. That's a little bit also the difference. They don't know they have a latex allergy. Some people could have no indication they have a latex allergy and have a severe reaction to latex. So, but most people that have a food allergy have put it together and know they have a food allergy. So somebody, could go in, eat something, and go into anaphylactic shock and not have any previous knowledge that they have a latex allergy at all.
Senator Stone, also, if I may, Mr. Chairman, we're talking about an allergy that is known, an allergen that is known versus an allergen that is not known. In other words, Lisa shared with me that she's allergic to kiwis and bananas, which interestingly enough has a cross-allergenicity to the proteins and latex. But when she goes to a restaurant, or when we all go to a restaurant, many times you'll see a disclaimer that if you have a peanut allergy, you don't want to eat this particular item on our menu. So you're given advance notice if you have that allergy that you can protect yourself and not ordering something that's prepared with peanut oil, as an example. Versus a latex allergy where somebody may not, again, know they even have the allergy, or if they have the allergy, they don't know if it's being used in the preparation of their food or in the administration of their medical procedure. So I think that's the significant difference. And also, we're not setting a precedent because 8 other states have already enacted this legislation.
Thank you. I'm chatting with Leo because now I'm more confused myself. But let me ask you more on the amendment portion. So. The amendment says that this bill is only limited to only latex gloves, not latex implements used in healthcare or implements used in food or the restaurant industry. So if I'm reading this amendment correctly, we're only trying to eliminate latex gloves, not the implements or the other items that they use in the healthcare setting or in restaurants for latex, correct?
Senator Stone, for the record, yes, Mr. Chairman, you're absolutely correct.
So if I am using a ladle in my restaurant that has latex, isn't that the same risk as me using a glove that has latex?
Well, I would say no, because the gloves are being used continuously in the restaurant. The ladle is maybe used intermittently. We didn't want to put a burden on the restaurants all tens of thousands of them in Nevada to go through their inventory of implements, and I think that would immediately kill the bill. But I think the most common exposure to latex in a restaurant setting is not going to be with the implements. I believe it's going to be with the gloves, and that would put a big dent into preventing people from getting the anaphylactic shock or getting rashes from the latex.
So the target of the amendment is to cover what folks are most exposed to, which are the gloves that often are either in preparation or in direct contact with patients, right? Is that?
Senator Stone, for the record, Mr. Chairman, that's correct.
Okay, got it. Now now I'm understanding of the amendment. Last question. Have you talked to the resorts about this? Maybe if you can give some context as to the industry, like what your conversations have been with them.
Yes, I've spoken with the resorts, I've spoken with the hospitals, I've spoken with the physicians, and that was the nidus for the amendments that you've seen in the 3 amendments that I presented to get them to either neutral or support. They'll have to come up here and decide how they're going to support the bill or not support the bill.
Great, thank you. Any other questions? No? All right, we'll go ahead and open it up to support testimony. So if you would like to provide testimony and support, we ask for folks to come forward, and we'll limit it to 2 minutes each. We don't have anyone here in Carson City or in Las Vegas, so AVH, is there anyone virtually, please?
If you'd like to testify in support on SB 184, please press star 9 on your phone to take your place in the queue. Hi, my name is Lindsay Carr for the record. Can you hear me okay?
Please proceed.
Thank you. Thank you, Mr. Chairman and the board, for the opportunity to provide testimony on this bill today. I'm here in support of SB 184 since this bill provides added assurance that latex gloves will no longer be allowed in restaurants, health facilities, and other establishments. I have a latex allergy, and although it's somewhat mild compared to what Lisa has talked about, I mostly have strong reactions when latex is involved with adhesives, which happens a surprising amount of times, and I'm also allergic to adhesives. I have friends and colleagues that are much more allergic to latex than I am, and this bill helps give all of us with any level of latex allergy more confidence that we won't have allergic reactions at establishments that we frequent. In particular, as someone who's had many medical issues throughout my life, including treatments for cancer and 8 other surgeries, and all the other appointments, tests, etc., that have gone along with those surgeries and cancer treatments, I am a frequent flyer at most of the medical facilities in the Carson City and Reno area. From cancer to hip surgeries, I've gone through a lot of different things in my life, and I've always had to make sure that I ask every single person that's involved with my care, doctors, assistants, every medical practitioner that I come across, whether the instruments or gloves that they use contain latex. Passing SB 184 would help Nevadans like me worry less about asking about latex products while we're going through some of the more difficult and pressing concerns that come up in our lives. And it would help ensure that products that contain a very common allergen are removed from places that can impact us the most. It will help us go to restaurants in our state without having to worry about whether or not a reaction might occur, and while having casual meals with friends and family. Thanks everybody for the opportunity to share with you today, and thank you, Senator Stone, for sponsoring this bill. Chair, there are no more callers in support at this time.
Thank you so much. Let's move on to opposition testimony. If there's anyone in opposition, we ask you please come forward. And as a reminder, 2 minutes each, please. We'll start in Carson City.
Good afternoon, Chair and members of the committee. For the record, my name is Peter Saba, S.A., B as in Bravo A, and I'm the Senior Government Affairs Manager for the Nevada Restaurant Association. We oppose SB 184 because it's an unnecessary mandate that lacks data to justify the impact it would have on the restaurant industry. There's no real data showing that severe allergic reactions due to latex gloves have occurred in restaurants in the state of Nevada. We fully recognize that latex allergies can be severe, even life-threatening for some individuals, and we sympathize with those who must take extra precautions when dining out. That's why restaurants already have proper measures in place to accommodate customers with allergies. Staff are trained to handle allergy requests, prevent cross-contact, and adjust food handling procedures when needed. Many establishments have already moved away from latex gloves voluntarily without a government mandate. People with latex allergies continue to dine out every day because they trust restaurants to accommodate their needs, just as they do with other common allergens like nuts, dairy, and shellfish. An outright ban is unnecessary as businesses are already taking responsible steps to serve all customers safely. Additionally, if additional transparency is truly needed, a disclosure on menus or signage would be a far more cost-effective solution than banning latex gloves entirely. Even if menus need to be reprinted, that is a one-time cost compared to a permanent price increase on every box of gloves for the rest of the time. Thank you for your time.
Hello, Chair Donate, and thank you so much to the members of the committee. I am Jacqueline Nguyen, Nguyen, here in opposition to SB 184. However, in receiving this amendment language, and I want to thank Senator Stone for really being very receptive to our concerns. We do have to send this back to our members, so we're hoping to be able to move off of opposition. But what I wanted to say is that in speaking to our members, especially our surgeons, for dexterity purposes, in many instances, latex gloves were preferable. It is common practice for all of our healthcare providers to ask if there is a latex allergy in the course of giving care. And some of our members also did note that some patients are actually allergic to nitrile gloves. So there is other considerations, but again, we are incredibly appreciative of Senator Stone for creating the amendment. I think there's maybe still some questions on the execution and how we apply for an exemption. But again, at this point, we are respectfully in opposition, but hope to eventually get to neutral. Thank you.
Hello, everyone. My name is Charlie De La Paz, and I am the state executive for ECAN, which is the Energy and Convenience Association of Nevada. And particularly on behalf of our convenience stores, we believe that Nevada already has a strong food safety laws, especially from NRS 446.867, that protect the public without hurting businesses. This bill adds unnecessary regulations that will increase costs, limit flexibility, and create more red tape for restaurants, food vendors, convenience stores that currently handle, prepare, and serve food, and more. While we also sympathize with the presenter, we believe that there are other ways in which our convenience members would easily support measures to create awareness around what products they are using for their food handling preparation in their locations. Thank you very much.
Thank you so much. Anyone else in Carson City? Seeing no one here or in Las Vegas, AVH, is there anyone online?
If you'd like to testify in opposition on SB 184, please press *9 on your phone to take your place in the queue. Chair, there are no callers in opposition.
Thank you so much. Let's move on to neutral testimony. Is there anyone in Carson City that would like to testify in neutral? Please come forward. And we'll start with Mr. Kelly.
Thank you. Good afternoon. My name is Patrick Kelly. I'm with the Nevada Hospital Association. I just want to thank the sponsor. We had 3 issues, and he has addressed all those in the amendment, and so we're very appreciative of that. He's been very receptive and has listened to us well, so thank you.
Blaine Osborne, Nevada Rural Hospital Partners, for the record. Ditto, we appreciate Senator Stone working with us on the amendment. Thank you.
Allison Herzik, Director of Nevada Government Relations for Dignity Health St. Rose Dominican. I'll just ditto. Thank you. And thank you to Senator Stone for working on us. We're working with this on us.
Thank you so much. Seeing no other folks in Carson City or in Las Vegas, AVH, is there anyone online?
If you'd like to testify in neutral on SB 184, please press *9 on your phone to take your place in the queue. Chair, there are no callers in neutral.
Thank you so much. Senator Stone, do you have any closing remarks?
Well, thank you, Mr. Chairman and committee, for listening to this bill. And while Nevada won't be the first state to pass legislation banning gloves in these settings, it's not too late to join the states that already have recognized the dangers of the latex gloves. It's our duty to protect Nevadans, including tourists, patients, and healthcare workers who are often exposed to the effects of latex. With ready available low-cost alternatives, Nevada should become the 9th state to ban latex gloves, and I strongly encourage your support on this measure, and thank you for your consideration.
Thank you so much, Senator Stone. We're going to go ahead and close the hearing on this bill and move on to our next one, which is Senate Bill 84. We are going to open the hearing on this bill. This bill revises provisions relating to domestic violence, so please begin when you're ready.
Hello, Liz Ortenberger for the record. I'm the CEO of SafeNest, and the Department of Health and Human Services asked me to present this bill. It's quite simple and hopefully a little less robust than latex today. We have one change in this bill that governs how we do domestic violence treatment in the state. So for those of you that are unaware, the batterers intervention programs are a diversionary program out of the court system that allows a perpetrator of domestic violence to go through 26 or 52 weeks of classes in order to curb, one hopes, their violence, but also provide them a justice system without incarceration for the offense. The change that we've made is that requiring that the curriculum and instructional materials used in the program be evidence-based. We've had evidence-based practices in the bill for a long time, but there has been some maneuvering within the providers, and we wanted to clear this up for behavioral health, who oversees the program, and make it very clear. Any curriculum that's being given in this state needs to be evidence-based, and that includes the instructional materials. And that is the complexity of the bill.
Thank you so much. Quick presentation, always lovely. Committee members, do we have any questions? No, I don't got one either. So let's go ahead and move it on to testimony.
Thank you.
If you're in support testimony for this bill, please come forward. We'll start here in Carson City.
Good afternoon, Chair and members of the committee. My name is Riley Svensson, RYLEY SVENDSEN, and I am the Policy Specialist with the Nevada Coalition to End Domestic and Sexual Violence. Batterers intervention programs are a critical piece in ending and responding to violence in our communities. But to be truly effective in reducing recidivism, these programs should be rooted in evidence-based practices. Therefore, we support SB 84. Thank you.
Thank you so much. Anyone else in Carson City? Moving on, there's no one in Las Vegas. AVH, is there anyone in support for this bill?
Testify in support on SB 84. Please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you so much. Anyone in opposition to this bill? Seeing none here or in Las Vegas. AVH, is there anyone online?
To testify in opposition on SB 84, press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition.
Thank you so much. And last but not least, is there anyone that would like to testify in neutral on this bill? Seeing none here in Las Vegas, AVH, is there anyone online?
And if you'd like to testify in neutral on SB 84, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral.
Thank you so much. I had one question that just came into my mind as I was rereading this. Liz, can you give us background? I'm assuming that there are random programs that are being stood up that don't have research behind as to what we're implementing, and that's the reason why the issue that we're seeing. Is it maybe if you can just give us a little bit more context before we close the hearing?
Absolutely. I'll run through the process. So if you are wanting to run a batterers intervention program in the state of Nevada, there's an application that you need to submit to the Department of Behavioral Health. That requires, in the past, just the evidence-based practices. Now it will require, should the bill pass, it will require evidence-based curriculum. So then behavioral services can oversee that program, and when they do their site visits, can ask for the documentation. It gives them more clarity on what they're actually looking for in the programs when they do their visits and things like that. So There is a program. There are 23 licensed providers through behavioral health in the state. But what we found in some informal research was that a lot of the providers were following sorts of an evidence-based curriculum, some evidence-based practices, but then some handouts that maybe weren't evidence-based. It was a little bit all over the place. We said, look, this is probably the one and only opportunity we have in the state of Nevada to do anything that looks like mental health support for folks who are perpetrating violence. Let's just tighten this up, make sure that everybody is doing evidence-based practice with evidence-based handouts and curriculum, and that's how this bill came to be.
Fair enough. Thank you so much. I don't think we have any other closing remarks, so we're going to go ahead and, unless if there's anything else you wanted to mention, but we'll go ahead and close the hearing on this bill. And that concludes the two bills that we had. So now we'll move on to the last agenda item, which is public comment. So if there's anyone that would like to provide public comment, I don't see anyone here in Carson City or Las Vegas. AVH, is there anyone online?
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. That concludes the items for today's agenda. We'll see everyone on Tuesday, March 4th at 3:30 p.m. for our following meeting. We got some good presentations and a few more bills. So looking forward to seeing everyone there. And thank you so much for joining us today. Meeting is adjourned.